Well, we're seeing our numbers rise incrementally, both in the general medical ward and slowly in the ICU. And we know that we're still in catch-up mode from all of the surgical procedures and all the delays in care for patients that were missed during the first wave. And so it's exceedingly alarming that now we're seeing numbers as high as they are throughout the province of Ontario, particularly in the GTA. The situation doesn't seem to be getting better day by day. We're all bracing ourselves for things to potentially reach a crisis scenario once the flu season hits. And obviously that's causing a great deal of apprehension around the medical community.
Steph, this was predicted. Months ago, they said the second wave is going to be worse than the first wave. I think Dr. Sharkawi was one of the ones that was talking about that with us. Now you've got shortages of reagent, you've got shortages of swabs, you've got long testing lineups, you've got ICU wards filling up, you got the government extending programs. Steph, what went wrong here? Are governments accountable for not being prepared?
Question becomes, who at the end of the day is responsible for this? And there are so many layers here, from the public health system at the very local level, all the way to Health Minister Patty Hajdu. But then there's also the question about the responsibility of individual Canadians who, yes, they are dealing with some measure of COVID fatigue, and yes, asymptomatic carriers are hard to find and track and trace. But then there are the folks we hear about in Ottawa who, they were feeling a little sick but still decided to go to a wedding. I mean, do people have no compassion anymore for their fellow Canadian and no concern about the damage literally they as individuals can do to the entire system?
Joyce, that has raised the question. To alleviate the testing stress, some are going to private clinics, getting $250 tests. In fact, some politicians have done that because they actually have the access to that. Will the crisis, one element of it, lead to calls for a two-tier healthcare system, something that Patty Hajdu says violates the Canada Health Act? Nonetheless, it's happening.
Yes, and Patty Hajdu can say that, but she also has access to the private clinic to go get herself tested, paid for by Canadian taxpayers. So, I think that we should stop listening a little bit to that and look at the reality of it. Today, if you want to have, for instance, a cataract operation, you can wait 2 years or you can pay $4,000. So there are cases, more and more cases, where our system is no longer universal, but it is a two-tier system.
Dr. Sharkawi, I mean, you've been preparing for this moment for 7 months when the pandemic arrived. What are you disappointed in that is not ready now? What did you think was going to be here that is not there, that you could say, I can't believe I'm in this situation as a doctor?
Well, the testing infrastructure, again, that's been the common refrain here. We all predicted that there was going to be a second wave. I'm not sure everybody agreed on the timing and the potential intensity of that second wave, but knowing that we were going to have thousands upon thousands of new cases and not having a testing infrastructure that was ready to meet those demands is concerning. Not having a rapidly accessible and cheap testing system that could be accessed outside of a medical setting is something that I think is a major shortfall in this pandemic management at this point in time. And to the point of, two-tier testing and private clinics, or private tests, let's not forget that the disproportionate majority of people who are affected by this virus are those with very little resources, those that live in racialized and marginalized communities. Those are the same people that are having difficulty accessing tests right now because they have to book online. So I have major misgivings about the potential use of a private system here to try and alleviate the so-called pressure on the system. I think that would be a mistake.
I'm glad you brought that up, Doctor, because there's a profound connection between the ongoing health crisis and the economic crisis. Steph, the Prime Minister announced new extensions of programs, wage subsidy extensions, rent subsidy changes and extensions. If we're in the second wave of the health crisis, are we in the second wave of the economic crisis, and what does that mean politically?
I mean, what it means politically is, again, if we twin the issues between the health crisis and the economic crisis, and we watch the way provincial and local health authorities are responding right now, they're moving into much more of a targeted shutdown approach, right? They're targeting hotspots, they're looking at specific regions, and back in March when the country shut down and the government moved fairly quickly to implement broad national programs for everybody, that was then. We learned a lot during that first wave, as the doctor said, about the marginalized populations that are disproportionately affected by this. So the question becomes, as we move into this second wave, does the financial supports and otherwise need to start being targeted accordingly? And I'll take as an example affordable housing. I mean, we're moving into the winter months. People who are living in substandard housing conditions can no longer hang out at the park, can no longer go for a walk around the block. This congregate living, surely it is going to be the site of more super spreading events. What is the government doing immediately and quickly to alleviate that problem, both in terms of rent assistance, both in terms of providing other forms of housing? You know, they have to start putting out these tiny little fires that both have a health implication and an economic implication, and one hopes that within all levels of government there are people doing this work, so they don't say, we're not here in March saying, just like we did with testing, just like we've done with so many other things, how did they not see this coming? Because we have the evidence now and they need to act on it.
Guys, just quickly before I go, we had the leader of the Green Party on, and Dr. Sharkawi, this is a medical question. She wants a by-election potentially in her riding in downtown Toronto to be stopped. The Prime Minister's now saying it will go on. Just as a medical point of view, is it safe to have a by-election right now in a riding? Would you say that's a good idea?
I don't think any situation where you're going to have people lining up in potentially close proximity to one another in droves is a good idea. I think it's abundantly obvious from what we're seeing down south of the border that anything that you can do remotely or virtually is probably a lot safer. So I would agree it's not a safe venture to go through with right now.
All right, guys, I got to leave it there. First of all, thanks for joining us, and I wish all of you a happy Thanksgiving. You got to do it under one roof, and all to our viewers as well. Take care. Maybe have a small turkey this year because you got to stay with your loved ones inside. Take good care. If you're safe and happy, have a lot of gratitude. There's lots to be thankful for still amidst a very difficult time. And if you can, help out someone who doesn't have as much to give thanks for, and there's a lot of people out there as well. Take care. We'll be back here in 7 short days.